Good morning, students! I am teacher Soterheim and Martorelias, and for today, I'm encouraging my students to be physically and mentally present for our lesson on health this day. For our first activity, I will be presenting a 1-minute video clip about one of the festival dance in Cebu. Take note on the important details of this festival dance because I will be calling random students to answer questions.
Siyempre ha, kailangan kayo mag-order ng torta para sa fiesta. Oo ba, anak? Kahala, mag-apura na kita. Araw-hapon na ang mga order na torta.
Alright, this time I will be calling students to answer this question. Our first question is, are you familiar with the festival dance shown in the video? Why? Our second question is, assuming that you are one of the dancers in La Torta Festival, what are your preparations for you to execute properly the dance steps? And our last question, in festival dances, is it possible that dancers may experience injuries? Give at least one example or situation of a dancer encountering an injury. Indeed, it is an undeniable fact that in festival dances, injuries can be avoided if one knows safety precautions. For today, our lesson is all about common unintentional injuries in La Torta Festival. And you are expected to recognize the nature of injury and its categories, discuss the steps in assessing emergency situation for common unintentional injuries, and assess emergency situations for common unintentional injury based on the standard first aid response. What I need to know to be discussed by our next teacher, Teacher Lian.
Hi, my name is Teacher Lian Marie Lumana, but you can also call me Teacher Lian. Now, class, I need you all to listen to this discussion carefully because afterwards we will be identifying whether these injuries belongs to the unintentional or intentional injuries. Now, okay, let us proceed to what do we need to know for today? What is it? Are you all excited? Alright, I can hear someone that they are excited. Okay, then let's proceed. Today, we will be talking about the injury in its two categories. Now, let us first define on what is injury. Now, injury, also known as a physical trauma, is damage to the body caused by an external force. Now, this may be caused by accidents, falls, hits, weapons, and other causes. And this injury is classified into two, and those are called unintentional and intentional injury. Now, teacher, what about them? Okay, let us first let us first talk about the unintentional injury. Now, unintentional injury, this refers to the injuries that are unplanned and typically preventable when proper safety precautions are followed. Okay? Okay, let's go. Let's proceed to intentional injury. Now, this intentional injury, this is something you do with the purpose of hurting yourself and others, and these are planned actions. All right. Okay, class. So right now, I will flash a few pictures, and I will need you all to identify whether this certain injuries are unintentional or intentional. Now we have here rape. I heard someone say intentional. Very good. It is intentional. Ankle sprain. Unintentional. Very good. How about muscle cramp? Unintentional. Excellent. Okay, what about these pictures? Bullying? Intentional. Very good. How about the abrasion or scrape? Unintentional. And suicide? Intentional. Very, very good. Now, class, good job. You got it all correct. You listened to the discussion very well and was able to identify the injuries based on its definition. Now, injuries do happen unintentionally and intentionally based on the nature of how these injuries occur. Unintentional injuries happen either when a person had no control of the situation or did not follow safety precautions. On the other hand, intentional injuries are planned injuries that may cause harm to others and to yourself. It is important to identify the type of injury you might encounter in order for you to know what aid you should give. Now that you know the nature of unintentional and intentional injuries, let us have an activity called Observe Me to know what will be our topic for today. Are you ready? Now I will pass you on to Teacher Henry. Teacher Henry?
Thank you, Teacher Leon. And hi, students. My name is Teacher Henry, and now we will be doing an activity entitled Observe Me. This time, I will present a short video, and what I want you to do is to watch it carefully because afterwards, I will be asking some questions for you to answer. Understood? Great! So here is the video presentation.
Are you okay? Look at her. It really hurt.
You okay?
Is she okay? He's holding her knee and it looks like it really. She can't even try out. Okay, 1, 2, 3, 4, 5, 6, 7, 8. Time. Okay, one more time. He did. You okay, Andre? Does that hurt? Does it hurt? Dre, what's hurting? You gotta tell me what's hurting. Oh, your foot. Can you move your toes? Andre is in some serious pain.
And that is all for the video. On to the first question. What type of injury is shown in the video? Are these intentional or unintentional injuries? Why do you say so? What is your answer? Good! The type of injury that is shown in the video are the unintentional injuries because injuries like this can happen accidentally. On the next question, is it possible that these unintentional injuries can occur in La Torta Festival dance? And can you give at least one injury that dancers may experience in festival dances? What is your answer? Great! So yes, of course, these unintentional injuries can occur also in La Torta Festival dance, and dancers may experience cramps and ankle sprains. And on the last question, if you are one of the dancers in the video, how will you approach to your injured fellow dancer? What is your answer? Fantastic. So in approaching him or her, you have to ask first if he or she is okay. And then you have to ask him or her on which part of the body that he or she feels pain and how painful is it to move. And after on that one, that is the time that you will call for help. Now in treating injuries, we cannot put aid directly to the wound or maybe stretch out a dislocated arm. But you have to know first how severe the injury is. Unintentional injuries require knowledge for you to know what you should do first before medical help arrives. Moreover, it is important for you to know on how to respond on emergency situations like this, or maybe like what was shown on the video, to avoid or lessen the severity of the injury. Now, in other words, you should know the process of responding to emergency situation. Now the question is, what are the procedures in responding to an emergency situation? But before you have to answer on that question, we will be dwelling to this more by discussing the steps in assessing emergency situations for unintentional injuries.
Okay, thank you, Teacher Henry. So good day, class. This is Teacher Leslie, and you can call me Teacher Les for short. So for our discussion today, we will be talking about first, the common unintentional injuries in the La Torta Festival. But in order for you to know what are these common unintentional injuries, we will be doing an activity called Unjumble Me. Okay, so I'll provide one picture or two pictures on the screen and unjumbled letters per unintentional injury. The only thing you need to do is to unjumble the letters for you to identify what common unintentional injury is being shown in the picture. Please don't answer in chorus and raise your hand if you know the answer. Okay, is that clear, class? Alright, so now let's proceed to our activity. First picture. What do you think is the common unintentional injury is being shown on your screen? Yes? Very good. It is ankle sprain. An ankle sprain, class, is considered the most common traumatic or acute injury in dancers. Most dancers will experience their first sprain by the age of 13. This injury is caused by any movements that force the ankle outside of the normal range of motion, resulting in an overstretching or in tears to the ligaments of the ankle. So the ankle sprain occurs when the strong ligaments that support the ankle stretch beyond their limits and tear. For example, Gemma, a dancer of La Torta Festival in Argao, suddenly slipped on a wet surface on the stage during the rehearsal in preparation for the grand showdown of Pasigarbo sa Cebu, causing her to fall that leads to a sprained ankle. Okay, so that's an ankle sprain. So it is one of the common unintentional injuries in the La Torta Festival. Now let's move on to the next picture. What do you think is the unintentional injury that's being shown on your screen? Yes? It's correct. Second common unintentional injury in the La Torta Festival is abrasion. It is caused by rubbing or scraping the skin against a rough surface. It is also known as a scrape or graze. Abrasion, class, is most likely to occur in the dancer's elbow, knees, shins, and ankles. Like for example, during the La Torta Festival street dancing held in Argao, Cebu, Marites, one of the dancers, was dragged by the people due to sudden commotion, where she lost balance, resulting in her leg rubbing on the rough ground. Okay, so that's the abrasion. For the next set of pictures, Again, what specific unintentional injury is this? Yes? Yes, very good. It is elbow dislocation. Elbow dislocation occurs when any of the three bones in the elbow joint become separated or knocked out of their normal positions. The common cause of elbow dislocation class is usually a fall. For example, the La Torta Festival dancers had a night rehearsal in their gymnasium. Thelma stepped onto the stair riser when she stumbled her feet, causing her to fall. She quickly used her hand to support her body, resulting in the dislocation of her elbows. Okay, so that's for the elbow dislocation. So now we're down to our last pictures. This is also common for dancers. And what do you think is the name of this injury? Yes? Alright, you're correct. It is muscle cramps. It is an involuntary, painful episode of sudden muscle contraction that can last from seconds to minutes depending on the severity. Muscle cramps can happen to any dancer at any time, and it usually occurs after an intense workout or rehearsal. For example, Lisa, who was late for practice, joined directly to the dance rehearsal without doing proper warm-up. Part of practicing a dance is to go with the fast music. After a while, she suddenly fell and shouted because she experienced muscle cramps on her legs. Okay, great job, class. Now to continue with the discussion, let's listen to Teacher Henry.
Thank you, Teacher Leslie. And hi, students. We meet again. Now, this time, I will be discussing to you the steps in assessing emergency situations, which we have here first, the primary survey. This refers to immediate identifying and treat life-threatening conditions. And then the second one, which is the secondary survey, that aims at obtaining a detailed history alongside checking with the vital signs and then performing a focused physical examination based on the patient's symptoms and history. Just like what you did with Teacher Leslie, I will be providing pictures with jumbled letters, and what I want you to do is unjumble them to find the correct answer. And also, I want you to listen carefully because this is for preparation on the next activity. Is that clear? Great! Now, these are the steps in assessing emergency situation in primary survey. Now, what do you think this picture represents? Great! This is danger. Now, before you approach the victim, always make sure that the area is safe. Now, once you have approached the victim and then you see that the area is unsafe, get the victim out of the area somewhere safe. Next picture. What do you think this picture represents? Good! This is response. Now check if the victim is responsive or unresponsive. As you approach them, introduce yourself and ask them some questions to see if you can get a response. Maybe kneel next to their chest and gently shake their shoulders by asking what has happened or open your eyes. Now, if the casualty or the victim opens their eyes or gives another gesture, that means, of course, they are responsive. Now, if they do not respond, or if they do not respond to you in any possible ways, then that means they needed to be treated as quickly as possible. Now on to the next picture. What do you think this picture represents? Fantastic! This is the airway. This is the next step, which you need to check that the airway is open and clear. Open the airway by placing one hand on the forehead to tilt the head back and use the two fingers from the other hand to lift the chin. Great. Now, let's move on to the next picture. What do you think this picture represents? Good. This is breathing. You now need to check if the casualty is breathing normally. Place your ear above their mouth, looking down their body, and you have to look down at their body, Now you have to listen on their breathing and see if you can feel their breath on your cheek. Watch to see if their chest moves. You can do this for 10 seconds. Now if they are unresponsive and not breathing, you need to call your emergency or your local emergency hotline number for help, and you can do CPR. And if you do not know how to do CPR, you can ask anybody near you that can perform CPR. Now let's move on to the next picture. What do you think this picture represents? Good. This is circulation. Once you have established the breathing and the airway, this is the time that you have to check if there are any signs of severe bleeding. Now, if they are bleeding severely, you will need to control and treat the bleeding by applying direct pressure to the wound and call your emergency local hotline number for help. Now, if they are unresponsive and breathing but with no bleeding, put them in recovery position and contact your emergency local hotline number. That is all for the primary survey. Now let's move on to the steps in assessing emergency situations and in secondary survey. What do you think this picture represents? Good. This is complete. Now, once you have completed a primary survey and treated any life-threatening conditions, move on to the secondary survey. Ask a responsive victim and those around them on questions about any of the incident that may have occurred. Your aim is to find out more about the victim's history, signs, and symptoms. If possible, you can take note of their answers. Now, leave the casualty in the position found until you are satisfied that it is safe to move them into a position more suitable for their injury or illness. Now, let's move on to the next picture. What do you think this picture represents? Good. This is history. Now you have to find out more about the victim's history. You can also use mnemonic ample as an easy reminder. Look out for any medical warning jewelry which may provide information on their medical history or any allergies. Now let's move on to the word ample. What does ample mean? We have here letter A, the allergy. Do they have any allergies? Just for example, such as nuts or maybe ankle medication such as penicillin or maybe aspirin. But this doesn't stay on this kind of medication. Or maybe, it can be other medications that they have allergies. That can trigger their allergies, of course. Now let's move on to the next letter, M, which is the medication. Are they taking any medication? Or are they taking any maintenance for their health? Next one is P, which is the previous medical history. Do they suffer from any medical condition such as diabetes, epilepsy, or heart disease? Or have they had any previous injuries or any surgeries? On the letter L, which is the last meal taken. When did they last eat or drink? And then the last letter E, event of history. What happened and where did it happen? Is the incident due to an illness or an accident? Ask any people nearby what happened and look for any clues that may give you more information. Now let's move on to the next one, or let's move on to the next step. What does this picture represent? Great! This is the signs. Now you have to look, listen, feel, and smell for any signs of injury such as swelling, deformity, bleeding, discoloration, or any unusual smells. When checking them, you should always compare the injured side of the body with the uninjured side of the body. Are they able to perform normal functions such as standing or moving their limbs? As you checked, make a note of any superficial injuries to treat once you've finished your examination. Now let's move on to the next step. What do you think does this picture represent? Great! These are symptoms. Now ask the casualty short, simple questions about any symptoms and sensations that they may be feeling. They should answer in as much detail as possible. For example, you can ask them questions such as, do you have any pain? Where is the pain? When did the pain start? Can you describe the pain? Is it constant or irregular? Is it sharp or dull? And lastly, you can ask this one, is the pain made worse by movement or breathing? And that is all. And let me lend you to Teacher Joby.
Thank you for that thorough and interesting discussion, Teacher Henry and Teacher Leslie. Now, we will be having our activity called What I Learned by answering the questions through discussing what you have learned in the lesson. Are you ready? Question number 1. What survey refers to immediately identifying and treat life-threatening conditions? Discuss and sequence the steps of the survey. Yes? Very good. The survey that refers to immediately identifying and treat life-threatening conditions is primary survey. The steps of primary survey are danger, response, airway, breathing, and circulation. The first step is danger, where the responder should make sure the area is safe. The second step is response, where it refers to checking the victim by asking him or her if she is okay. The third step is airway. This refers to opening up the airway if you check that the victim is unresponsive. Then proceed to step 4, which is breathing by checking the victim's breath, if it is normal, and if the chest is moving. The last step, or the fifth step, is circulation, where you will check if the victim has severe bleeding. If so, call 911 immediately. Question number 2. What survey that aims at obtaining a detailed history along with vital signs and then performing a focused physical examination based on the patient's symptoms and history? Discuss and sequence the step of the survey. Yes? Very good. This survey is called secondary survey. the steps of secondary survey are complete, history, signs, and symptoms. The first step is complete, where this refers to completing the primary survey and aiming to know more about the victim. The second step is history. This is where the responder checks the background of any medications of the victim or has he or she undergone surgeries. The third step is signs. This is the stage where the responder checks for any swelling, bleeding, or discoloration of the injured part. The last step, or the fourth step, is symptoms. This is to check what area does the victim felt the most pain, or is he or she capable of moving. Primary and secondary surveys represent a comprehensive and continuous aspect of victim assessment. The components of the assessment apply primarily to trauma scenarios, but are applicable to most patients. This process provides a comprehensive clinical picture of the patient. In La Torta Festival, dancers may experience unintentional injuries. These injuries may depend on the severity as to what action must be done on the victim. It is important to assess the emergency situation before giving an immediate action so there will be no worst cases. For the next activity, you will be applying what you have learned in our discussion by assessing the situation. This activity is called Assess Me Appropriately. Further instructions will be given by Teacher Leslie.
Thank you, Teacher Joby. Now, we will be doing an activity called Assess Me Appropriately. Okay? So there will be one emergency situation of a common unintentional injury that occurs in La Torta Festival. And I want you to read it in your mind and understand, because afterward, I will be asking some questions. Okay? Alright, so here's the situation. Jane, a dancer of La Torta Festival, had a rehearsal with her co-dance members. Upon the rehearsal, she suddenly tripped and twisted her foot, causing her to stop dancing. Leo, her co-dancer, noticed it and immediately ran towards Jane. Okay, now, if you are Leo, what is the first thing you would do in this kind of situation? Yes? Alright, very good. If you are Leo, the first thing you should do is to apply the steps by conducting primary and secondary survey. It is important to assess an emergency situation because we cannot perform emergency procedures directly without knowing the details of an injured victim. You will first conduct the primary survey, wherein the first one is to always make sure that the area is safe. And second is to ask the victim if he or she is okay. Then you will proceed to the secondary survey, where the first thing is to complete the primary survey. Then obtain information such as the history of his or her medications, the allergy, and so on. You should also look for signs if her wound is swelling, had some deformities, if it is bleeding, or begun to show discoloration. Lastly, you should also ask the victim what area does the injury hurt or how painful it is to move a body part, so you will determine what kind of treatment you will be giving to Jane. Next question. Why is it important to assess the situation before giving immediate treatment to the victim? Yes? Alright. It is indeed significant to assess an emergency situation because we cannot perform emergency procedures directly without knowing the details of an injured victim. Please take note, class, that it is important to be knowledgeable when it comes to analyzing emergency situation. It is also important to be cautious always when giving an immediate response to victims. Of course, helping someone in need is a big responsibility of thinking what ways we could extend our help. Responding to emergency situations require knowledge of how to give life-threatening treatments before medical experts arrive. On that very moment, your knowledge saves someone. Okay? And knowing the steps in assessing emergency situations ensures safety for yourself and for others. Be reminded to be aware of the surroundings, and you may not be able to control a dangerous place, but you can prevent yourself from being unsafe by following safety precautions and measures. Okay, that's all for today, class. We can really see that you understand our discussion for today. And for your assignment, let's hear from Teacher Sotero.
For our assignment to be checked next meeting, I want you to prepare an emergency bandage in preparation for our lesson next meeting. If bandages are not available, you can prepare alternatives like handkerchief or long face towel. These materials will be used for our activities next meeting.
According to Bree's law, every single person in the world has the capacity to save a life. It is an essential gesture of solidarity. First aid education should be accessible to all without discrimination. When we encounter victims with injuries, we must think that giving an immediate first aid should be avoided, such as stopping the blood by applying pressure or stretch when you see a person dislocated his arms. We should know how to assess by asking the victim if he is okay. Look at the wound if there are scraped objects surrounding it, and making sure that the area is safe or away from danger. Assessment must be done depending on the severity of the injury or what kind of injury the victim is having. If ever you have been to hospitals or clinics, you observe that the health workers will not directly give you aid on your injuries or wounds, but will first assess your consciousness. We should see how big the responsibility these workers are holding. As a student, these basics must come at hand when you encounter someone or any member of your family and know what to do to prevent worsening of situations. This definitely that your knowledge saved someone.